screen. So I'm just going to go through the slides. All right, so I want to acknowledge the kickoff by giving credit to the founders. We have done this event for the last 5 years here in New Jersey in partnership with a couple of other organizations, Chocolate Milk Cafe. We've worked with our board member, Michelle Gabriel Caldwell, but we didn't start this initiative on our own. It was developed by the 3 women that you see here, Kimberly Sears Allers, Kadada Green, and Anaya Ayoka. And they started this event 10 years ago. And so from their work is kind of where we are today. The theme this year is 10 years, a new foundation. And so basically that theme surrounds the new foundation of lactation support is built on racial equity, cultural empowerment, and community engagement, and is powered by our collective resilience. And so just please share the event on your networks. These are their hashtags. You can share the events that are going on for the week. I do want to just quickly introduce everyone to our team here at Perinatal Health Equity Initiative. So I am, again, founding executive director. Brittany, I'm excited to welcome as our new director of maternal child health programs. Alexis is our executive assistant. She helps with all the organizational needs and works directly with myself and Brittany. Zakaya, who is here on the line, she is a new addition to our team as well. She is our program development specialist. Zakaya, I don't know if you want to introduce yourself or say anything.
Sure. Can you hear me?
Mm-hmm.
Okay, awesome. Hi, everyone. As Natasha mentioned, I am the program development specialist, and I think I wear a couple hats, but really my role is to help to execute and ensure we are implementing our programs. So nice to be here, and thank you for the intro.
All right. These are 2 of our lactation members. Both Romy and Asia are certified breastfeeding specialists. They work in our Sisters Who Breastfeed group and our Pathway 1 to become IBCLCs, as is Latoya. Latoya is a peer breastfeeding counselor. She works in our Southward group. And Zuli, which my apologies, Zuli, I did not update her name. Zuli is our intern who is a current MPH student. Just a quick overview of our programs. Sisters Who Breastfeed is our breastfeeding support group. It is a peer-to-peer, mom-to-mom support group that we established back in 2019. I am proud to say that we have grown that group to approximately 800 members, so 800 Black breastfeeding women, mostly in New Jersey, but we do have some moms that are in the PA area, New York, Connecticut area as well. We provide support primarily in person, virtual, and so we do funnel those questions in that group. It's moderated by the team that you just saw. And so if the needs go beyond being able to address it in a post, then we usually bring those moms in for either a consult with one of our peer counselors, one of our CBSs, myself, or we'll do a virtual support group to help them meet their goals. And then in addition to that, we do upcycles for pumps. So we collect spectras, anything that's a closed system. We usually will ask for those donations of those pumps. We clean them, we upcycle them, we give them back to families who need them. And this is especially important for our preemie mommies who tend to have some barriers with accessing a hospital grade pump. And so although Spectra does not label themselves as a hospital grade pump, it does have a high quality suction, and so does help to bring that process along. So we will provide the pump, we'll provide the tubing, we'll provide the flanges and everything to help them get started, and we will continue on with that process. And then we also provide clinical lactation support. So as I mentioned, we have some families who will encounter us through the group, and if they need additional support, we then bring them into our clinical lactation side, where we will do full scope evaluations. We will check in with their progress on their care plans. I will see them as an IBCLC if needed, and that team is expanding. We have 2 new IBCLCs who will be onboarding shortly. And we do that service primarily free or low cost. And we also provide wraparound services through another program we have called Tanita's Garden. So if there is a need for diapers, wipes, cribs, car seats, any birth related supplies, we supply those things to families in need as well. I'll pause for a second because I see Brittany has joined us. I gave Brittany a shout out a minute ago, but if Brittany, you just want to say hi and welcome to everyone.
Good afternoon. My apologies. I was on the wrong platform, but I'm just excited to be here with the entire team. I understand the assignment and I understand the mission. So I'm just really grateful and thankful to be a part of the team. So welcome, or hi everyone, and I'm happy to be here.
Thank you. All right, so let's talk data. What we do know is that Black women have one of the lowest, well, the lowest breastfeeding initiation rates in the nation. That's been a longstanding issue. This isn't new information. But Black women do breastfeed. And so sometimes we look at that data and say that, you know, Black women aren't breastfeeding at the same rates as other groups are. And so sometimes the time and effort is not invested in those Black mamas to make sure that they are successful. But remember that there was a long history of breastfeeding prior to slavery. And so we definitely had some gaps in autonomy, breastfeeding not being our decision. And so that changed culturally what breastfeeding looked like for us. And so what you're seeing now is a resurgence to kind of this return to our roots, where Black women are increasing their breastfeeding rates and are driven to reach that goal. But there are some unique barriers that we face, some of which are work and competing obligations. So we know that Black women have higher rates of being the primary breadwinner in their home. And so the ability to stay out on leave is not as equal to other racial groups. There might also be other competing demands. For example, if housing is a barrier for you, breastfeeding is not as high on the list. And so we need to look at, again, the whole social determinants of health and how those things continue to impact our breastfeeding rates and outcomes. This week exists specifically because of racism and our roots to slavery. We know that Black women were wet nurses and were required to breastfeed the slave master's children and neglect their own. And so that definitely had some systemic changes that happened when the choice is not your own to be breastfeeding. And so there was some resistance that took back of kind of taking back our bodies and making decisions not to breastfeed. Along those same lines, we had formula companies who were targeting Black families specifically, which continues to be an issue today, really trying to direct people away from, Black people specifically, away from breastfeeding. Due to those same issues, we have our own cultural barriers and traumas. Breastfeeding is not as always accepted in our families, and so many women are faced with needing to hide breastfeeding or are told mistruths about breastfeeding so that if a child reaches a certain age, they shouldn't continue to do it, or it's something that should be done in secret. So there's some shame associated with it. But then there's also some trauma and sexual abuses associated with those things as well, which unfortunately is higher in the Black community as well. And so when you hear terminology like nasty, for example, associated with breastfeeding, there's usually some history behind why that person is making that statement. And then the other thing is insurance and Medicaid. One of the things that came back in our study, which I'll talk about in a minute, is barriers to access. And so when we have Medicaid populations, which are higher in the Black community, which does not provide a direct line of support to an IBCLC, and insurance companies who create barriers where you need to pay out of pocket first before you receive reimbursement, that limits the ability to access care. And so while New Jersey does have some amazing legislation surrounding removing those barriers, those legislations have not gone into effect as of yet. So right now, we still have some situations where Aetna, for example, and AmeriHealth are the two insurance providers in New Jersey that currently credentials IBCLCs. Everyone else is pretty much on a self-pay. And if income is an issue, your ability to self-pay is limited. And so that limits your access. And so why does that matter specifically to Black women? It matters because we have the highest maternal mortality rate. We know that hemorrhage is a link to that. And if we have early breastfeeding initiation, it reduces the risk of hemorrhage. We know that Black women have the highest infant mortality rates in existence. And so early introduction to human milk can help to reduce some of those complications we see in preterm infants. Highest rate of dying from premenopausal cancer. It is August, but soon we will be in October, where it's Breast Cancer Awareness Month. And unfortunately, breastfeeding is often left out of that conversation, but it's a very important public health issue that the duration and time in which a woman spends breastfeeding, each year of doing that decreases the risk of developing premenopausal breast cancer. And so it's really, really important. We know from the data that Black women that do develop cancer, breast cancer, are more likely to develop an aggressive form of it and more likely to pass away from it. So if we can get more Black women breastfeeding, we have the potential to impact data there as well. I mentioned the preterm birth rates. We know that that human milk is medicine, and that the rates of admission, readmission, length of stay are decreased when an infant has access to human milk. From our work, which I'll present to you, we know that some of our NICU moms expressed not having access to donor milk when they needed it. And so that's an area of concern we want to raise. And then we know that there are also high rates of sudden infant death syndrome in our community as well. Some of that is safe sleeping practices, but we also do know that formula feeding is associated with a higher rate of sudden infant death syndrome. And so if we have more infants who are receiving human milk, then we have a decrease in the rate of sudden infant death syndrome. And I want to just always bring this in the forefront of any presentation that I give about human milk, is that we need to be able to look at this beyond the nutritional value that it provides to the infant, because it does do that. It does an amazing job of providing the optimal nutrition to a newborn, but it is a healthcare behavior because there are public health implications from the decision that is made by the parent to provide human milk for their baby, not just on the infant's life, but also on the mother, for the reasons that I mentioned previously. So we've got to move beyond talking about human milk as solely a way to feed the baby, because it goes well beyond that. These are our national breastfeeding rates. And so this is the latest data from CDC, and we know that there are still some disparities when it comes to Black non-Hispanic women and their infants who are breastfeeding. So while our ever breastfeed, and this really for reference point could mean one time, it means any sort of breastfeeding, so those numbers are coming up. Where we continue to struggle are our exclusive breastfeeding rates. So at 3 months and 6 months, and you can see the longer it goes on, the less exclusive breastfeeding we have. And the trick with breastfeeding is, one, the exclusive value of it is what gives the most benefit, but then also that duration, the longer that baby receives human milk, provides protection to both the infant and the mother. And so we're losing a lot of mothers and breastfeeding people at that point. And our formula percentage supplementation rate, this is national, which isn't terrible. But New Jersey, we definitely could use some work on our numbers. So these are the initiation rates for Black women. And you can see that over time, these rates have gone up. And so although 73.6 is not on par with our white counterparts, it is an improvement from where we were in the past. And so you can see that the work that we're doing is impactful and making a difference. And so everyone needs to continue to push that same message. This is data specific to New Jersey, and this is as a whole. ever breastfed, breastfed at 6 months, breastfed at 12 months, and you can see our year goes down significantly, and our exclusive rates are still down significantly. But we can see that we are closing that disparity gap. And this is New Jersey specific data that I pulled from March of Dimes, which is from our CRAMS data. You can see that our Black breastfeeding rate is pretty close to where white and Hispanic breastfeeding rates are. So that's an improvement, and that's a good job that our state is doing in that area. And then when our exclusive breastfeeding, you can see that we are also closing that gap at least the 8-week mark. Black women and birthing people are actually breastfeeding at a rate that is higher than our Hispanic and white counterparts, which is great. But where are we with our Healthy People 2030 goals? So there were some changes that were made to Healthy People 2020 objectives. There was much more data that was collected. The new 2030 regulations really are just looking at exclusive breastfeeding. So looking at our exclusive rates at the 6-month mark and doing any sort of breastfeeding. So the infant is receiving some sort of human milk by age 1. And you can see we're still short. The purple is New Jersey, and the blue is the Healthy People goal. And we are quite short of our goals there, but I believe we can continue to work towards them. Next, I want to shift gears to our New Jersey breastfeeding landscape study. So we were funded by the Burke Foundation to conduct a landscape analysis of what Black infant feeding practices look like in New Jersey. So what that meant for us was really looking at all 21 counties, collecting data using kind of a mixed method practice of both quantitative and qualitative data. As I said, the study was funded by the Burke Foundation. It has IRB approval through Montclair State University. And so we explored all the areas in which breastfeeding and human lactation has the potential to be interrupted, or where there's some assets that are going really well. So some things that we looked at, and this is not an inclusive list, but relationships with providers, our Black matriarchs, employment barriers, incarcerated women, and childcare. And so this is really preliminary data that we're sharing. We're still in the process of completing our survey and collecting data. Just to share our framework, we used Black feminist thought and a social ecological model to develop our framework for the study. Right now, we have collected data from 109 Black breastfeeding women. And I'm using the word women because they all self-identified as women. It was a question we asked in the study. They all identified as African-American or African on the African diaspora. They had to reside in New Jersey, given birth between 2019 and 2022, and had to be at least 18 years of age. This is kind of a rough view of our demographics. Age range was between 21 and 43. 43% had a 4-year degree that was completed. 66% worked full-time and were returned to work on location. 59% were married, 53% planned to exclusively breastfeed, and 78% of those women made that decision prior to pregnancy. So again, this highlights the need of, by the time we have encountered a pregnant person, I won't say that it's too late, but it is not when the decision-making is happening. So we are kind of missing the boat on when the important conversations need to be happening. When it came to prenatal education, most participants researched what they wanted to know about breastfeeding online. That was 75%. Another 66% went to friends and family. 55% went to virtual support groups. 56% said the benefits of human milk were discussed specifically by their providers. 71% did not take a breastfeeding class. And I think that jumps out at me as a lactation provider, because that is something we struggle with all the time in our respective circles. It's something we talk about a lot, is why aren't people taking the breastfeeding classes? And I think some of this data gives us kind of a peek into why. Most people felt more comfortable looking at the information on their own. And so we might need to start doing some digging about what is it about prenatal breastfeeding classes that is either not of interest or not available. to our families. Another thing that jumped out at me is that 83% of participants reported receiving free formula samples in the mail, despite selecting that they were planning to breastfeed, and 49% of that was unsolicited by mail. So that is the mailings that are coming from the formula companies, which I recall getting as well. As far as birth experiences went, 22% experienced an induction, 67% of births were vaginal, 81% had skin to skin within that first hour of birth. And that is really, really good. So I do want to highlight that those things look like they are going well. Hospital practices that were going well, most participants selected that they were offered support with breastfeeding without asking first. They had access to a lactation provider before discharge. So meaning a hospital provider, someone saw them before they went home. Staff was supportive of breastfeeding, and staff appeared to be knowledgeable in breastfeeding. So those are all things that are going well. Some of our greatest areas of opportunity, there was definitely a lot of comments about lack of diversity in clinical staff, both on the nursing side and on the lactation provider side. Formula supplementation in general was an issue, but also specifically to the NICU population, there were a lot of complaints from families about not having access to donor milk, not being supported in their lactation goals. So that's an area of opportunity for us. And then the other was community-based referrals. So while many reported having access to good support in the hospital, they lost that support once they went home and really weren't able to connect with the people they needed to connect with to continue to reach their goals. And so many of them did that research on their own. But this may be a gap we need to look at as far as our continuity of care. When asked what people felt was missing, Black lactation and nursing staff came up again, sharing of information and community resources, improved access to home and virtual lactation support, and weaning support came in often as a concern that as people were ending their journey, that they did not have the resources to kind of properly go through that process. This is a quote from one of our participants. The main thing is that I wish I had a lactation consultant lined up for when I got home. I didn't know who to call, and it was only because of referral from my doula, so shout out to the doulas, that I got in touch with someone. If I didn't have a doula, I probably would have formula fed longer or exclusively. My daughter had a tongue tie, which potentially impacted her ability to latch and breastfeed. I could not have overcome that on my own. So again, highlighting the community need of support. Once people were home, we asked some questions regarding workplace support. And so we found that, again, although there was a gap in finding access to those resources or being given those resources, many moms were resilient and sought that information on their own. Another gap was 49% expressed not having any knowledge or information on their rights as an employee who was providing human milk. 50% of them were unsure of the lactation coverage provided by their insurance company. And that came up quite often as just the insurance company not being clear with what was provided, and so not really knowing what was available. And then what I did find interesting as well is we did ask a question surrounding what was the amount you were willing to pay for lactation care. And $50 to $100 was the investment that came up most often, followed by not willing to pay at all. So this again highlights to why there might be some gaps in accessing service, because right now we still don't have insurance full implementation by the insurance providers to cover lactation support. And so when there becomes a financial request to follow up with that care, that is limited. And if you are seeing an IBCLC, this is not an investment that is going to cover that care. So really looking at where are these gaps and how can we fill them in. Another major issue that came up was mental health gaps. 49% reported experiencing postpartum depression or some sort of anxiety, and 21% of those mothers reported not receiving any support for those needs. So a few quotes, it made me want to give up on the beginning, and pumping was a nightmare. I got no sleep, so it didn't help at all. And another quote, I experienced extreme anxiety and depression when we struggled to get my son to latch and successfully feed for the first week home. Having all the responsibility of feeding also impacted my mental health. Feeling like I couldn't pump enough to leave my son with someone else for more than an hour was hard. Again, so we're looking at mental health issues popping up again because of that lack of continuity of care and lack of support. And moms are really asking for those first couple of weeks to really have more hands-on touch with providers. So what's next for us in this study? We have a couple of focus groups that we need to finish up. We're looking at talking specifically to WIC participants, our Black matriarchs in our families, and Black fathers. And then phase 2 of the study is moving into photo voice, which is where families will be provided with instructions on how to use photography to document their breastfeeding journey, surveying various providers, formula feeding moms, so specifically looking at the reasons for selecting formula, and then also some questions surrounding the formula shortage that we're in, and then also highlighting models of care that are working. We do need to be careful of making sure that the narrative that we paint is not solely based on disparity, but then also adding some value of showing where are things that are going well and highlighting and replicating those models. I wanted to give a quick update of some things that we have going on. So we have a professional mixer that's happening tomorrow night. So if you are Black in lactation, this is a great space to meet other professionals. We have a surprise announcement that we'll be making at this meeting. We are doing our first annual photo shoot, which will be at Branch Brook Park, and that is on Saturday. Kimberly Seals Allers has an amazing event that is happening in the city. So if you are able to come and support, that would be wonderful for her. We've shared on our social media, and I can also drop the links for anyone that needs them later on. And then I want to thank everyone for coming to our brief summary for Black Breastfeeding Week and getting an update. And then I want to hand the floor back over to you guys to find out if there are any questions or things that you guys want from us. As we enter in this space, what we want to acknowledge first and foremost is that Black Breastfeeding Week is not a week for us. This is what we do 24/7, 365. We are an organization who is focused on eliminating disparities in Black and infant and maternal health, period. So while we're highlighting some of these issues this year, this week, this work will continue year round. And so we want to kind of give the floor back to you guys to see if there are things that you feel would be important for you to know or things that you would like to see as action items for us. So I'm going to stop sharing. And the chat should be available for anyone that has questions or comments. Our contact information, I'll just drop in the chat. If you need to reach out to us for any reason, you can always use our email. So if there are any questions, you can drop those into the chat or into the Q&A section. And if there aren't any questions, yes, the data will be published. We are going to be putting out a report. That report should be available sometime before the end of the year that will have a formalized written report of infographics and the data that we've developed from our report. Our aim is to create some teaching tools based on the feedback that we've gotten from families, so that information will be available. All right, well, if there aren't any additional questions, I hope to see you at some of our events over the week. If you're not following us on social media, we do have some other events that will be coming up over the course of the year. And so we want to make sure that you stay in tune with those events. But I thank you all for coming and listening to our presentation and highlight of our research thus far, and hope to connect with you soon. Thank you.